Happy Friday, everybody. Welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got some really interesting topics today. First off, the epic feud between Erin Moriarty of The Boys and Megyn Kelly, formerly of Fox News, about plastic surgery. We're going to discuss it. Then, are Arctic zombie viruses the next possible pandemic? We'll take a look. And then finally, we're going to answer some questions from the Nip Talk audience that they submitted, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is the wonderful Sarah. How are you?
Howdy.
Doing good. Travis, how are you, buddy? Anything good?
Cannot complain.
Yeah.
How about y'all?
Doing good. Another
Pretty
Friday.
good.
Cloudy Friday, but not rainy.
Yeah.
Absolutely.
Yeah.
I like the cloudiness and I like the rain though. I do like the rain. I can't lie.
Yeah, I don't know, man.
It's very Twilight movie outside.
Yeah, it's very gloomy.
Twilight movie.
I don't know. I'm not as big a fan of the rain. Like, I don't, just like, I guess because I drive around so much, I'm going from place to place, and then if it's like raining, it's just kind of a hassle to get there, and then you're all
Traffic
wet.
is really bad when it's rainy.
So
yeah.
I kind of prefer. Now, if I was like off, maybe like in a cabin in the woods, then I could do with some rain. But like in Dallas traffic, I'm not as excited about it.
Me either. I kind of flew here.
Oh,
There
did you?
was, like,
You
no
were
traffic.
very early today. Yeah.
I know. I
Felt
was
bad, like,
surprised.
it was making
I'm
you
chronic. I'm very I'm always like 10 minutes late to everything in life.
That's kind of how I am too. I'm just kind of.
My friends are like, it starts at 4:30 and it starts at 5.
Did they tell you that whatever's going to start like 30 minutes early? Just so
Sometimes, but some of my friends, you have to tell them that it starts like an hour before it actually starts.
Oh, really?
You know somebody has a reputation of being late when you like, oh yeah, you were on time, and then they reply as, oh, I'm surprised.
Yeah, I know, right?
I was surprised
when you show up on time and people are like, oh wow, you're here.
That's funny.
And that's why I'm like, I
You
just
never
can't.
late.
And I always tell people, I'm like, I'm sorry. Like, this is just,
Yeah.
I try.
You're never late. You are never late. So
Yeah.
I want to correct that. You're never
Yeah,
late.
you always show up exactly when you're supposed to be there.
Facts.
Well, anyway.
Stressful.
All right. Well, let's jump into some segments because we got some interesting ones. I'm going to have to have you guys help me unpack all these.
Ready.
So, all right. Have you guys ever seen the show The Boys?
Yes, and it's so gross. But
It's so
also,
good.
I like it, though.
Travis, have you seen The Boys?
Oh, yeah, I love the show.
Dude, I love The Boys. Like, I'm a huge fan. And I have to say, if you haven't seen The Boys, definitely check it out. But just know it absolutely pushes the bounds of like
Super
what's
graphic,
decent to put on
violent.
television.
Facts.
But yeah, so one of my favorite actresses on that show is Erin Moriarty. She plays Starlight, and so I actually really like her. I like her character. She just seems like a really great person. Well, have you guys heard about the huge beef that she and Megyn Kelly, who used to be on Fox News, had this past week?
I have not heard that. Nothing.
Wow. So, all right. Well, this is pretty crazy. So, Megyn Kelly was the girl who was on Fox News for so long, and I don't know if she left or I can't remember why she's not there anymore. I think something bad happened, but I can't really remember. So she has her own podcast now, and
Of course.
yeah, I mean, why
We have
not?
our own podcast.
Not that I'm say, hey, if you want a podcast, do it. So she has her own podcast, and I think it's pretty popular. People watch it, and so she did a podcast a week or two ago. And she talked about Erin Moriarty and about that she thought that she'd had too much plastic surgery. So it was a long episode. I clipped it down to like a minute and a half, but I want to show it for you guys. I kind of did the highlights. So Travis, can you roll that clip from...
gal who starred in both of those. Her name is Erin Moriarty, and she's 29 years old, and she's a beautiful actress. But she's decided to completely change her face. This is a picture of her before, which I think was relatively recent, within the past year or so. Now look at her. Look at that. She's got the Kim Kardashian lips. She's made her nose so skinny, it looks like a pencil now. She's got like what appear to me to be cheek implants. You know, you like huge, the cheekbones are like out to here. She look like a nice, beautiful, natural gal. And I'm sorry not to pick on this Moriarty gal, but this, like, more and more young women are doing this, Michael. It's not about an objection to plastic surgery. It's about an obsession with turning yourself into this fake version of yourself. I find it like a sign of mental illness. It's extremely upsetting.
Plastic surgery almost never, maybe not one single time ever, has made someone look better. All of these cosmetic procedures are.
Oh, I don't agree with that. I don't agree with that.
You disagree?
I've seen a lot of women benefit from, in particular, nose jobs, and men. I've seen that too. Look, I'm not against plastic surgery. This is something else. This is like a mental disorder. This is extreme. When you start off incredibly beautiful and you end up like a plastic Barbie version of a Kardashian. Like, and who did that to her? Who is the surgeon who said, yes, I will?
So, wow, yeah.
My mouth dropped.
You should have seen Sarah whenever she put up the after picture, I guess.
I saw Travis putting those pictures up, and I was like, oh, yeah, I know her. And I saw that picture of what she looks like now, and I had no idea that was her. I thought he was just putting up a picture of some other chick.
I don't think I would have recognized her. So I mean, it was a pretty brutal takedown of Erin Moriarty in that clip, and we're going to kind of discuss this, but Erin Moriarty apparently was none too happy with Megyn Kelly, and so she made a post on Instagram, and I think I have a picture of it. I mean, obviously you probably can't read all that, but in this post, she says that she's quitting social media, she's barely been able to eat or sleep. She did state that before picture was actually 10 years old, not a year old, which it is a kind of an older picture. And then she went on to say that it's all a lie, that, you know, it's fake news, that it was actually contouring makeup that made her look like that. And also she went on to say that she was pretty upset with her fans because I guess people were saying, hey, this probably is a little bit too much, and that she was, you know, basically denying them the privilege of having her on social media. So she's saying she's signing off social media. So yeah, it was pretty brilliant. Of course, all the news, you know, people are talking about this right now. It's kind of like a big beef, and you know, people are like taking sides on this. So it's kind of been a pretty interesting thing to watch. So I guess the first question I have is, you know, is Megyn Kelly right that Erin Moriarty had work done? I don't know, what do you guys think?
I mean, from that picture, yeah, she doesn't look like the same person at all.
Charles?
Yeah, I would say so.
Yeah.
That there's no way you
There's
can
something.
look that different with the contour makeup.
So
I could
agree,
give it to her if she was like using some type of like weird Instagram filter or like TikTok filter or something like that. You can definitely
you can make yourself look different.
yeah.
But
At least based on the picture, if the picture's real. And in fact, Megyn Kelly said in her podcast, she's like, at first I thought it was like an AI
yeah, I want to
filter
see a
created.
picture of her, like what she's saying, like what she looks like right now. Like,
Okay, so I do have some pictures. So as far as has
freaked
Erin
out.
Moriarty had work done. So, you know, I'm a big fan of hers. And so maybe 6 months to a year ago, I saw a picture of her on social media. I was like, oh my gosh, she's had something done. So I want to throw up not a picture that's 10 years old. This picture, the first picture, Travis, is from 2020. So it's 3 to 3.5 years old.
Okay.
And so, I mean, I absolutely recognize her there. She's all glammed up for some festival or awards banquet or something, but you can tell it's Erin Moriarty. So I want to show a picture of last year, and this is the one where I was like, oh my gosh, I think she's had work done. So when you compare those two pictures, like the first thing I thought is that she may have had buccal fat removal. You notice that her cheeks, like her lower cheeks, which were, you know, fairly full and what I would consider normal contour in the previous picture, are really hollow right now. You know, she has.
Well, you say that when you say that, whenever I was watching the show, the first season,
Right.
she had like a normal figure. Second season, she looked extremely skinny to me.
Right, and so that.
She lost, in my opinion, way too much weight.
Okay, so that brings up.
That to me looks like she's just like her face is sunken because she's just
underweight,
too skinny.
I mean, that's definitely a possibility because that was my next point is this buccal fat removal versus just she's had a really extreme weight loss. I mean, it is possible for sure. You know, I don't have the picture of it, but I actually zoomed out of this picture to see, like, did she look like her body was much thinner? I mean, she's always been thin. I mean, even in the first season.
She just looked athletic. She looked like
she looked athletic.
But the past season that she was in, that I guess they're waiting for third season,
right,
I guess.
wait for the next one. Yeah.
Yeah, like I noticed.
She was too thin.
Yeah. I was like, she wasn't, like that outfit she was wearing, the Starlight outfit, didn't look right on her anymore.
Because she was so thin.
She was so
I mean,
skinny.
it is possible that she just lost a lot of weight, but I don't know. I mean, I'm kind of on the fence on that one because, I mean, you'd almost have to be malnourished to have that hollow of a look when you start out looking like she did. And I don't want to say that she at all had like chubby cheeks at all, but she had a very normal kind of round face. Like she looked normal.
Yeah.
And in that picture that we just threw up from 2023, her cheeks were really hollow and her nose looks thinner. I mean, if you compare that, and we can show it, there's a combo at the end. So yeah, okay.
That's the biggest thing. The nose looks very different.
The nose looks pretty thin to me in that picture. And then go to the next picture from 2024. So, I mean, to me, she's not really recognizable, and definitely she's had lip filler, I think, without question. And I think that she may have had some some cheek augmentation, probably filler, like something like Voluma or one of the very similar products, because in that picture, her cheeks look much fuller to me than they did in the previous picture. And I don't know if I buy the contouring makeup, because I know we've talked about contouring makeup and how it can make you look, quite a bit different.
I could see maybe the nose, because she definitely looks like she has contour makeup on her nose, for sure.
She does.
But, and maybe the
angle. But it just looks thinner. I mean, even in that picture before, it looks thinner. And like, if you look at the contour on her right, our left in the picture, I mean, her cheek is much, larger than her.
I think her cheeks definitely look really full.
Yeah, they do look full. So, I don't know. And then let's go to the progression so you can see. There's that combo picture. Yeah, I don't know. I mean, I think it's very reasonable to assume she had something done. A nose job. It looks like her nose is much thinner, but in those pictures. And then I don't know about the buccal fat removal. I mean, I guess it could be really, really significant weight loss. You can see her collarbones between 23
and her neck.
Yeah,
it's skinny.
Yeah, it may just be that she lost a lot of weight. I don't know.
I just remember seeing her in that Starlight. She used to wear that uniform, and now that uniform was wearing her.
was wearing her.
Like, really, if you go and look at pictures, she was like, it looks like it's just like hanging on her.
Yeah, I can't remember. I'll have to rewatch that season. I remember her looking different.
I remember being like,
yeah,
like not like she looked bad, but it was just like she just didn't look like this like athletic, like strong woman like she was
right, like she did. Yeah, she looked great in the first two seasons.
Yeah,
like really great.
Yeah, she just looked like she was in shape. Mm-hmm. Like you're like a superhero would look.
Yeah. Well, I do have to say I feel like Megyn Kelly was kind of harsh in her analysis. And,
I mean, yeah, she just wanted them views, though.
Yeah, she wants the views for the views, and I can see how Erin Moriarty would be upset. But I mean, you have to know if you're an actress, especially a big time actress like her, because The Boys is so popular.
It is.
That people are going to make mention if you change your appearance.
For sure.
I mean, that's going to happen. So
yeah. I thought it was funny that she was like, she just looks like a Kim Kardashian knockoff or something, or whatever she said.
I mean, she has a point. And so, I guess the next thing, to discuss is Megyn Kelly right that people are making fake versions of themselves, and is this a problem?
Yeah.
I mean, as a plastic surgeon, I like to see all sides of everything. I personally feel if somebody wants to change their appearance, then that's their right, whether they be the average person on the street that nobody knows or a superstar. I mean, people have the right to do what they want, but I mean, you have to expect that people are going to notice. Other people are going to notice. If you change your appearance, people are going to know and people are going to talk about it.
People are going to have something to say because that's your life. You signed up for it.
Right, yeah. And, I think a lot of times the stars just kind of get swept into it and they don't realize it. Now they're under a microscope and every little thing they do, people are going to pick apart and say, things about them. And, for better or worse, it is what it is. The only thing I would say is if she has had work done, which I do think she's had some work done, fillers, nose job. I always hate when celebrities look different and then they deny they had something done, because I just feel like that makes a unrealistic expectation of, okay, someone can just change their appearance by changing their diet or putting on some makeup. And there is some truth to that, but I don't think to that degree.
I mean, honestly, one of my friends in high school thought that I got a nose job.
Oh, really?
Yeah.
Because your weight
Just
changed?
from contouring my face.
Oh, from contouring.
Yeah. They thought I had a nose job. They swore that I had a nose job.
I don't know. With her, I think she did, because in that first picture, I mean, I think there's a definite difference in the shape of her nose between the first and the next two. And the next two, they kind of look the same.
I know that like your nose has cartilage in it, so it can get inflamed sometimes.
Yeah, it could.
Because like whenever I was pregnant, my nose got wider.
Really?
Yeah.
Well, you probably were holding water too.
Yeah. So like I think your diet has something to do with it. Like some people like have a gluten allergy, so when they eat gluten, it inflames their body.
Could be.
It makes you. That could be all to do with how she was dieting, what she was eating. Because I know whenever I started working out better, my face got thinner. My nose, obviously, probably to some people it looked like it changed.
I think that there's zero.
I could give her benefit of the doubt with her nose.
With her nose, okay. I mean, I can accept that, because
that's the easiest thing to contour.
I would weigh more on the side that she has something done, but I wouldn't, bet my life on it as far as her nose goes. But as far as like the lip filler and the cheek filler, I don't think that is deniable. I mean,
no, you can definitely see that.
Yeah, and the buccal fat removal, I mean, she has lost weight. I think it's a little bit of an extreme change just from weight loss, but not out of the realm of possibility. So, but yeah, it's interesting. They really were kind of going at it. I haven't heard if Megyn Kelly said anything back about that. I didn't see anything, although
I'm sure she doesn't care.
She probably doesn't. That girl
She's probably like, cool, now they're gonna wonder why she made this post, and then they're gonna come find my video.
I mean, that's exactly what happened.
Yeah.
I mean, 100%. I mean,
she doesn't care.
I don't think she cares either.
I mean, at the end of the day, Erin does not look ugly, or like she still looks pretty. She just doesn't look
like herself. Yeah.
She doesn't look like herself anymore. She looks like somebody else.
I mean,
and if that's what she wanted, she succeeded. And good job.
And I agree that absolutely 100% people should be able to do what they want. I personally don't like that look, her new look. I think she was just gorgeous, and I was thinking to myself, if she came in and wanted me to do stuff, like would I have done it? And it's like, if somebody brings you a beautiful painting and say, can you fix this up? And you're like, well, what? It looks really good. Like, what do you want me to do? I don't know. I definitely would not have made her look like she does now. I just couldn't in good conscience do that and make someone look like a different person, especially a celebrity. I would not want to be the person that did her work.
Yeah.
No way. I would absolutely not. I mean, as I've always said a million times, to me, the best plastic surgery or the best aesthetic procedure that you have is the one that nobody knows you've gotten.
Yeah.
And they're like, not sure.
You just look
just
a little better.
Yeah, just a tiny bit better. So.
Yeah.
But yeah, that's a pretty interesting story. I'll have to follow this up and see if there's any more kind of follow up.
Yeah, I'm sure season 3 she's not going to look like that.
Well,
I wonder if they're even done. I wonder if they're done with that show.
No,
because I'm like,
they just filmed the whole season. The new season's about to come out.
But she's not going to look like that. She's going to look like the normal Erin.
Oh, right.
She's not going to look like Erin 2.0. In season 3. So I don't. What if at season 3 that's the end?
Oh, it might be.
She's not filming.
I don't know. I don't know if
because
it's the last season or not.
To me, if I feel like that's like part of like when you're a celebrity, it's like if you're on a show like that and you something drastically change your appearance, I feel like that's in their contract that they can't do that. If I was in charge of a series or a movie or something, I'd be like, hey, you can't get it, like you can't drastically change your appearance.
Yeah, that is interesting. That's an interesting question, because I would assume that the show producers would be like, whoa, what'd you do here?
Yeah, it's like Rachel from Friends. She couldn't get her hair cut without, I'm sure, talking to somebody on that team.
Yeah, you're probably right. I didn't even think about that.
So it's like, she's probably done.
Dang.
I bet.
Spoiler alert. Sarah just spoiled the show. Now Homelander is going to take out Starlight. Now we know, thanks to Sarah.
I bet anything that she's done with that show.
You never know.
Maybe. Sarah, if you're right, I'm gonna give you the biggest props
Buy
in the
me
world.
food.
She's clairvoyant.
I will, man. I'll buy you a steak dinner if you're right, because that's
Thank you.
impressive. So.
Thank you.
That's
All
right.
right. Well, we'll follow up on that and see what happens between the feud between Erin Moriarty and Megyn Kelly. It's pretty crazy stuff. So, all right. Speaking of crazy stuff, I saw this article floating around this week, and I thought it was pretty interesting. And I have to say, I got caught a little bit in clickbait with this one because the article is about Arctic zombie viruses.
Wow.
And I was like, wow, there's a new virus that's going to turn me into a zombie. I absolutely can't pass up the opportunity to learn about this. So I dug in. Yeah, it wasn't exactly what I thought, but it was very interesting.
Is it a virus that's like, when it gets unthawed, it's going to like take over the world?
Yep, Sarah, you got it. That's exactly it.
Oh, it's like a movie. Cool.
Yeah. Well, so as we all know, wherever you sit on the whole climate change discussion, that the Arctic is warming up to a certain degree, and so they're seeing a defrosting of permafrost, which is that huge, thick layer of snow and ice that's been around since, I guess, whatever the last ice age. And you always see those movies where the ice thaws and there's an alien in it, and the alien runs around and kills a bunch of
I
people.
hope that's what it is.
That would be more interesting for sure.
Not that they kill a bunch of people, but that they're just like, oh.
Oh, there's an alien in the ice. That would be interesting.
Yeah, instead of that weird Mexican alien that they
That was so bad. You didn't hear about that anymore. But anyway,
I know.
so scientists aren't really worried about aliens, as interesting as that might be, but they are worried about ancient viruses. And there was a paper that came out in 2023. It was in the journal called Viruses. I'm going to throw a picture up if you want to go read it. Some very weighty reading called An Update on Eukaryotic Viruses Revived from Ancient Permafrost. And this paper details how a team up in the Arctic, I think it was Siberia or somewhere in Russia, Siberia, something like that, found 13 new viruses in the permafrost that were previously unknown, and that potentially could infect humans. One of them they identified to be over 50,000 years old, and the others they think could be up to millions of years old.
Oh.
And they've just been frozen in the ice.
Isn't my science brain's coming into
What?
to be my sciencey side of my brain?
Okay, you're about to acknowledge us.
The eukaryotic, those cells are smart, right?
Right.
Because there's prokaryotic,
Right, there's
which
prokaryotic
are
and
like
there's eukaryotic.
more like the dumber
Yeah, these
version.
are considered large viruses.
Yeah,
they're
so
megaviruses.
they're like
yeah, they're big.
they're serious.
They
Yeah.
can be serious.
Yeah,
they
they're
can
like
be
the
serious.
smart ones.
So they dubbed these things zombie viruses, which I really hate that because I think a zombie virus should turn you into a zombie. I mean, right? Am I wrong
Yeah,
on
they
that?
just put what is it supposed to do to you? Just like
All right.
kill
Well, they
you?
don't know. That's the thing. Yeah. So they just
Oh.
they call them zombie viruses because they're resurrected from the dead out of the ice. And I was like, oh. But I was at that point I was already committed to the story, so I'm like I had to go all in.
The disappointment.
I know, right? I was like, oh, zombie virus, cool.
I'm like media at its best.
Yeah, I know. So these scientists are concerned how modern human immune systems might respond to ancient viruses. Nobody really knows, right? And with human activity in the Arctic increasing because of exploration, drilling for oil, and the fact that it's warming up and it's becoming a little bit more accessible, there is an increased risk that someone could be exposed to a virus that was previously unknown, and with the way we travel all over the world today, something like that could spread very quickly. And so, of course, everyone wants to know, is this like real? I mean, should we be worried about this? And the answer is probably not, but
did the frost,
but maybe?
the ice kill it, or when it?
So perfect. That's a great question. So the opinions are mixed. So the head researcher talked about this. His name's Dr. Schaffner. And he said that the risk is a real thing, but it just depends on a lot of factors. And you said the very first thing that he said is, can the viruses even be resurrected? That's a great question. Then can that particular virus be transmitted to humans? And then does it have the ability to spread? And then also, do these viruses have the ability to evade our immune system, which overall is very, very effective? I mean, we're covered in bacteria. We're constantly exposed to virus. And for the most part, we walk around and we're healthy.
Yeah, I wonder if there's more like bacteria and viruses, like less bacteria and viruses up there, not because there's no people, but just because of the temperature.
I would think so, for
Right?
sure. I mean, a lot of, what do we do?
They can't live there.
Yeah, what do we do to our food to keep it from spoiling?
Yeah.
We throw it in the refrigerator, keep it cold, and that way the bacteria can't go through. And
So I wonder if like where that virus like originated, like if
great.
if
Or-
up there it used
yeah.
to be like warm tropical, and that's where it was.
could be, for sure.
Interesting.
Yeah. So I was just going to talk about the types of viruses they found. They found 13 viruses of 5 types. So I guess the higher up level taxonomy. There was Pandora virus, Cedravirus, Megavirus, Pac-Man virus. I remember that one. I heard about that one before. And then there was a new kind of whole new strain called Pithovirus. And so, like I said, they haven't found that any of these will infect humans as of yet. I think the ones that they found, they're not really that concerned about. But if they found these, then the question is, how many more are out there? And is there one, as you said, that could have survived all this time and then could potentially infect humans and cause a pandemic? And yeah, I mean, the threat is not inconceivable.
Yeah.
Is it realistic? Probably not. I mean, but we have new viruses pop up all the time. The novel coronavirus that we all went through. Ebola, I mean, that was the bad one. So when I was in college, I was in this medical class of some sort. We had to write a thesis. So I wrote a 30-page paper on Ebola. I mean, I didn't sleep for a few nights. Like, I do not want to get Ebola. Basically, you just bleed out of every orifice and turn into liquefied goo. It's like the worst thing ever. And remember when that Ebola case happened in Dallas? Do you guys remember that? It was like 2011 or 2012. Yeah. I was seriously like prepping. I was like prepping for, okay, how am I going to get out of town? Because that Ebola is bad stuff.
Yeah.
I mean, one of the Ebola strains, the Ebola Zaire, has a 90% mortality rate.
Where did that virus originate from?
Zaire.
Where's that?
Oh, Africa, sorry.
Oh.
There's Ebola Zaire, that's the really bad one. It has like a 90% mortality rate. Ebola Sudan has like a 50% mortality rate. And then there's an Ebola Reston, which is mostly infects monkeys and not people. And it's much less harmful.
And that's all in Africa, or you said Middle Sudan is that Africa?
Yes, yeah,
Oh.
yeah. But it's gotten out, and so there was a case in Dallas where somebody I guess was in Africa, contracted Ebola, and then traveled here, and then everyone was worried, was there going to be this crazy pandemic? And I was.
Did people get it in Africa a lot?
No, it has like outbreaks. Fortunately, Ebola is not an airborne virus. You can only spread it by direct contact with like blood. But the thing is, when you get it, you just bleed out of your nose, your lip. I mean, your every hole basically is bleeding.
Remember all those old movies from but based in America, like old Western movies? It's like everybody's like dying because they're like coughing and there's blood on their napkin.
Oh yeah, they all had tuberculosis.
Yeah.
That's what they had. Yeah.
Yeah,
But
okay.
similar, yes. It's like that, except it's not just your mouth, it's your nose, your
I just
eye.
remember that was like in every movie. It's like every movie
Like in,
in like
Tombstone.
Western
Remember
movies.
Tombstone?
Yeah.
Yeah, that was a good one.
Everybody's just like coughing and they're like, ugh.
Yeah. So I thought it was interesting to read
Crazy.
about these ancient viruses, and all the movies always are worried about some, ancient alien being defrosted.
I think we talked about some other virus that
Did
was
we?
like
We talked about the fungal. Remember the fungus that was
gonna
the zombie fungus?
Yeah.
Was that it?
Yeah, and scientists are like they think that if there was going to be a zombie
It could
thing,
be that. Yeah, right.
Because
of that show, The Last of Us.
Yeah.
That's all about the zombie fungus. So yeah, these are zombie viruses, but unfortunately or fortunately, they do not turn you into a zombie. As entertaining as that might be to see.
they themselves are zombies.
Yes, they're the zombies.
Yeah.
But I thought it was cool. It's something to think about, as the planet, warms up. If that keeps happening, they may find something interesting up there. And hopefully it won't be something that causes a big
Hopefully it's
pandemic.
aliens.
I hope for that too. I'd like to see the
And
aliens.
not the
and not the
ones-
crappy
not the Mexican
Mexico aliens. Those were so bad. Terrible.
With like
Do better.
with like powdered sugar on them.
I know, they look like a donut. Okay, let's move on. So we had our social media team actually reach out to you, the audience, I think it was last week or the week before, asking a question. I think we have a post about the post that we had there, which was, what do you, the audience, want us to discuss? And so we actually had several people type in some questions, and I want to thank Kate W, LNC, and Annette K for submitting some questions. And so I'm going to read these out because these are what they wanted to know about. So first question was, how long does it take to become a plastic surgeon? So more or less, and this answer can vary just depending on the path you take, but it's about 15 years after high school to get there. So it'd be like 4 years of high school, 4 years of college, 4 years of college, 4 years of med school, so that's 8 years. And then typically about 7 years of surgery training. I did 8 because I did an extra fellowship that I didn't necessarily have to do, but I just wanted to do it. So for me, it was about 16 years.
So you were like in your 30s when you started.
When I started
practicing.
when I started my practice, I was 35.
Okay.
Like when I started working for real. That's like kind of hard to think about, that you're not, until you're really doing what you're trained to do, you're 35 years old. It's pretty wild. The next question was, what is the fun parts about being a plastic surgeon? For me, I went into plastic surgery because I like art. You know, to me, plastic surgery is like art and medicine blended together, and I really do enjoy that. For me, it's almost like you're creating something new.
Yeah,
and not to devalue a patient as like a piece of art, but there is an artistic side to it, and I really, really do like that. I like making something that is considered beautiful.
Yeah.
Or taking something that, you know, needs help and making it, you know, normal again.
Yeah.
Both of those really, really appeal to me. So that's what I like about it. And it is nice too that you work with patients that want to come see you. You know, when I was in general surgery or doing trauma surgery, like that patient doesn't want to be there with a sick gallbladder or be in a car wreck. That's the last thing they want. And that's fine. I mean, you still help them and everything, but it's kind of cool when patients come to you and they're like, I want to come see you and talk about this thing. Mm-hmm. I like that.
I have a quick question.
Yeah.
So you said you didn't start actually like practicing until you were like 35.
Mm-hmm.
What are you doing between that point?
So, there's the 4 years of...
Well, not schooling wise.
Like, okay, I mean, in between.
Like work wise.
So surgery training. So that's the residency.
Gotcha.
So you are working as a resident, but you're still considered, I don't want to say a student, but a doctor in training is probably...
Do you get paid as a resident?
You do get paid, but the pay is really, really low.
Yeah. Like
super low. In fact, before they started cutting the hours back, I calculated how much money I was making as an intern, and it was like $2 an hour. Like literally. Because, one, they don't pay you a lot. Mm-hmm. You know, my intern year, I made $30,000, I think, or maybe 29, I can't remember. But I was working 110 hours a week. And so when you calculate it out, I was like, geez, I'm getting ripped off here. But I mean, you're getting trained, you know? I mean, you're training, it's like an internship for a job where you get paid nothing or very little.
Right.
If you want to know more about it, Travis, just watch Scrubs.
Don't watch Scrubs, it's so bad.
Is it bad?
I think it's hilarious.
It's so hard for me to watch those shows because they're just so unrealistic. I mean, Scrubs is kind of funny, but you know the terrible one's Grey's Anatomy.
Oh, I've never watched that.
That's funny.
It's about surgery residents.
Yeah.
And I was a surgery resident when it came out. I was like, this is absolute trash. Okay, next. Someone asked, what are the specialty areas that you can go into from plastic surgery? That's a cool question. I'm not sure we've already talked about that. So there's actually quite a few. I personally did a cosmetic surgery fellowship, which those can vary. I did a breast and body cosmetic fellowship. There is facial ones, facial aesthetics. The other specialty areas are hand, which I do hand, but I'm not a specialist in hand. I didn't do extra training for hand.
What kind of surgery do people get on their hands that's like for cosmetic reasons?
It's not for cosmetics. It's more like reconstruction and fixing problems. Yeah, it's not cosmetic.
I was like,
I still do hand trauma, but I don't do as much elective hand. So for example, if you have bad arthritis in your thumb and you need your joint replaced or fixed, I just don't do that anymore because I just don't get enough of those cases to keep my skills where I want them to be.
Yeah.
But I do lots of the trauma, so like fixing broken bones and fixing tendons that are cut and things like that. So there's hand. Craniofacial is a big one. So craniofacial would be the doctors that do the cleft lip, cleft palate, and then the skull remolding in kids. Those are really cool surgeries. I mean, I could get privileges to go do them, probably overseas. I could probably get them here, but it would take a little bit of jostling because most people that do that are fellowship trained in craniofacial.
Yeah, they do that all the time.
There is a burn fellowship. I mean, not a lot of plastic surgeons go on to do a burn fellowship, but I have seen a couple do that. Mm-hmm. That would be kind of an atypical one. And the other one that was fairly popular and I think is going to be less popular is microsurgery. Whenever the deep flaps, which we talked about those, is like that's that reconstruction method that that I think we're going to see kind of diminish because insurance are not paying as much anymore.
Okay.
These fellowships popped up in microsurgery, which is basically where you're sewing blood vessels together. Any plastic surgeon should be able to do that, and I do that still to this day, more related to hand trauma. If I see a cut artery, I'll repair it. I don't use a microscope personally. I use they're microscope glasses as opposed to like a real microscope, which that may be confusing, but it's just like a lesser version of a true microscope.
Yeah.
So that's another specialty area. So those are the main ones. How do we get the next generation interested in becoming doctors? I think that there's always going to be interest in people wanting to be doctors.
Yeah, I was like, is there a decrease in doctors?
I mean, if you ask any doctor, should you go into medicine, they're going to say no. And my feeling is if you were a student saying, I want to go to med school, if I can talk you out of it, then you shouldn't do it.
Right.
You know, the only person that should go into medicine is somebody who can have someone else stand there and tell them, don't do this, and they're just like, I'm going to do it anyway.
Yeah.
Because if you go in wishy-washy, you're going to be miserable. I mean, the life is hard. It's so stressful to get in, and it's stressful throughout med school as you're trying to compete for rank to get the specialty you want. Then it's stressful trying to get into the fellowships.
I mean, to me, I'm like, it should be stressful. You have people's lives like literally like
it's extremely
in your
stressful.
hand.
Like
Yeah.
residency is super stressful, although it's not as bad as it used to be because of work hour restrictions. And then when you get out, there's just a lot of regulation. It's hard to be your own boss anymore, which is one of the big reasons I went into medicine. Is like, oh, I can have my own practice, be my own boss. And that's what I did, but that's not what most people do. Most people become employees of the hospital or join a big group, and they're just another cog in the wheel.
Right.
So, I mean, but all that being said, I don't think that there's a huge drop in people wanting to go into medicine or be doctors. There's always going to people be interested in it because it's a calling for them.
Yeah.
And you can't talk. People try to talk me out of it.
Yeah.
You know, and I was like, no, I think I'm good. I think I'm going to do this.
Yeah.
But then now that I'm on the other side of it, I see, you know, why people said that, you know, because it's always changing, and typically it's changing for the worse for the doctor. Well, it is. I mean, like the pay is going down, the work is going up, the autonomy is going away. And so, yeah, I mean, I would much rather have practiced 30 years ago than today.
Yeah.
Because it just was better. And so, you know, is it likely to continue that trend? I mean, probably. So it's hard for me, you know, to encourage someone to do it unless I just can't change their mind.
Yeah.
So, all right, what's the most common injury in children that requires plastic surgery? I would say dog bites. I've sewed up, I don't know how many kids that have been bitten by dogs.
Yeah.
Oh, wow.
That was the big thing. And I don't do it as much anymore because now most hospitals will not let you operate on a kid because now everything's become compartmentalized in medicine, and where 10 years ago I could admit a kid to a regular hospital and do surgery on them, now they say, well, we don't have people who have the extra training that was invented to take care of a kid post-op. And so I don't do as much kids as I used to do kids literally all the time because plastic, you know, what happens is your kid gets cut and you go to the ER, what do most people say? I want a plastic surgeon to close it. And I did that for years and years, and you know, it's not a, you know, glamorous case, but you're helping a child and the families are very thankful, and it's rewarding. So I did that a lot. But yeah, I'd say dog bites.
I was bit by a dog as a kid.
Were you? Did you have to get sewn up?
No, it wasn't that. It was a little chihuahua.
Oh, to those little guys, they're nasty, man.
Yeah. It left a mark, like it left a scar, but it didn't it didn't have to get like sewn.
I got bit 2 or 3 times by dogs. I mean, it was different, you know, when I was growing up. People just let their dogs roam loose. My parents let me roam loose. And so every once in a while, a dog and me would get intertwined in an interaction. I got bit in the face and on the leg and on the hand. In fact, I still have, you probably can't see it, but that scar is from a dog bite that goes all the way down my hand.
I have one on my hand as well.
I got one on my knee. I got one on my face, but it's really kind of faint now. But, but I love dogs. I'm not, you know how some people get bit by a dog and they're afraid of them.
Right.
I still love dogs. It just, you know, some dogs are.
I've been bit by my own dogs.
Really?
Yeah, because they get in fights.
Oh, yeah.
Facts.
My dogs know if they bite me, it's adios, doggo.
I have a question for both of y'all.
Okay.
Besides actually like filming, and then also besides like the stories that we talk about, because that's like the typical one. What is your favorite part about like podcasting? Like, what is your favorite part about the show? Besides, like I said, besides filming and besides the stories that we talk about.
You know, for me, one, I enjoy like the camaraderie that we have. Like,
Yeah.
me and Sarah, you and me, Travis, and then the people in the studio. I enjoy coming down here and doing it. I really do like that. Also, I really enjoy talking about topics that I feel can educate others
Facts.
and help other people avoid something bad that happened to someone else.
Yeah.
So that's probably what I like, Sarah.
Yeah, I feel the same way. I definitely like coming here and just like goofing around because I
Yeah.
feel like I'm like.
It's like we're having fun.
I feel like
it's
sometimes,
serious,
yeah,
but
you're
we're having
talking
fun.
about serious stuff, and I'm like, I say something completely ridiculous.
I know, but that's good because.
But yeah, no, I enjoy like trying to do that because usually, honestly, in real life, I'm more of like the serious.
The more serious.
stoic
You can be
person.
the serious one time. Although when you do segments, you will get very serious, and then I'm like
do.
cutting
You
jokes. and
definitely,
stuff.
you definitely do. When you get like locked in, you
Yeah.
are locked in.
She's locked in, right? And I'm over here like. "Brr, brr, brr, brr."
It's probably because I'm like, oh my gosh, I hope I say the right thing.
Okay.
Because I like give myself a script.
Right.
I
Yeah,
think
I
I'm
know.
better
I
when
used to
I-
like really when I'd make these cards, I would follow it really closely. Now I just use it to help me stay on point and just
Yeah.
not totally get off into left field. I don't really read off of it. It's kind of like, oh, okay, next.
Like an outline.
It's an outline, right? All right. So I have two more questions I want to hit because people ask these and I want to answer them. So somebody asked about thread lifts. Now I know we did a segment about thread lifts.
did. I
And
had
so
no
I'm
idea
not going
about
to tell
this.
that person to go watch the segment, but I'll just kind of give a recap. I'm not a huge fan of, so for those who don't know, a thread lift is where they take a barbed thread and run it through your face and then pull it to tighten your face like a type of facelift that's non-surgical. So I don't think any plastic surgeons that I've seen are fans of thread lifts. It's mostly done by aesthetic non-plastic surgeons, dermatologists, or doctors that just have a med spa because it's an option that they can offer for skin tightening that if they can't do surgery.
That gives like a drastic result.
Yeah, I mean, the problem with thread lifts is, it's definitely temporary. It doesn't last that long. The threads are absorbable. They don't always resolve at the same time, so you can get asymmetries as they start to break down. They're a real problem if they get infected. That's probably the biggest risk is that those threads get infected in your face. And that's not common, so don't feel like that's really likely to happen. But if it does happen, it's a problem. And the person that did it's probably not going to be qualified to take care of that problem.
Yeah.
So I'm not a big fan of thread lifts. If you look at some of the befores and afters, right after, they don't look bad.
It sounds bad.
Yeah, so I'm just not a big fan of those. We did do a whole segment on it, so if you want to learn more, you can check that out. Finally, someone asked about at-home red light masks. Have you guys heard of red light therapy?
Yeah, on TikTok. I've seen
Yeah.
a lot
Oh, it's
of
on
them.
TikTok. I guess I
Yeah.
need to get more on TikTok because every time I say something, you're like, yeah, it's on TikTok. And I'm like, oh, I didn't even know. So red light therapy uses low wavelength to improve the skin, reduce wrinkles, improve scar, and to help redness and acne. And how it works is it's thought to stimulate the mitochondria, which is the powerhouse of the cell, which does all the work. And it makes the energy-producing part of the cell more active so it can do more of that work. It also stimulates fibroblasts, it also stimulates collagen, increases circulation, and decreases inflammation. And there's a lot of data to show that that's what red light therapy does to cells.
Okay.
It's also safe. There's not really big risks from doing red light therapy, so it's not a risky treatment at all. But as far as are there really great studies that show that it makes a big difference on your face? I mean, there are studies that show that it's promising. We've talked about studies and that there are levels of quality of studies with randomized double-blind studies being the top one. They don't really have anything like that out there that shows that this really makes a big difference. But there are lesser studies that show that it is promising and it probably does have some beneficial effects to your skin. So that's red light therapy. So the question that they had is what about the at-home red light therapies? Well, with anything that you do at home that is something that could be offered at a doctor's office, it's pretty much a guarantee that the at-home version is going to be a much scaled down, less powerful version of that.
Yeah.
So does it help to some degree? Probably.
Yeah. I wonder if it's better than putting retinol on your face.
I think it's
if you
just
use,
probably
retinol
another
every day
something
or
that you could do.
in conjunction of your normal skincare.
I would say that if you had a decent at-home red light and you used it consistently and you did that for say a year, and you were able to clone yourself and the other person didn't do it, I would bet that probably the person that did the red light therapy would see some difference.
I think it's really cool that you that we could clone ourselves, though.
Yeah, that would be cool. I wish I could clone myself so I could send my clone to work and then I could sit at home and watch like movies.
And do red light therapy.
Yeah, do red light therapy on myself. Yeah. So at-home red light therapy, there's not great data to show that it's something that's going to make a big life-altering change for you. But there is some data out there to support that red light therapy in general helps, and then it's just a matter of how powerful it is, and you kind of have to look and see how powerful.
I think I have like a body one.
And do you?
But I don't use it consistently. As I say, I think I have
I mean,
one.
I've heard a lot about red light therapy.
It has like blue light on it too. What does blue light do?
I'd have to look it up. I don't know off the top of my head. I mean, all those lights hit different things and do different effects. So just off the top of my head, I don't want to tell you.
I'm going to look at it.
Yeah.
No, I'm going to go find
Makes you
it.
into a zombie. I don't know.
Of course.
So yeah, red light therapy. I do think it's probably helpful to some degree.
It's not bad for you.
It's definitely not bad for you. Yeah. So.
Well, makes you feel good, then.
Hey, if it makes you feel good, do it. If you want to put filler in your face, makes you feel good, do it. We're all about you do what you want to do. All right, I think that's about all the time we have for today. Thank you guys so much for tuning in. If you want us to talk about something else, leave us a comment. We'll talk about it. And we'll see you next week on Nip Talk.
Bye.